Welcome to our channel. If you want to access preventive health screenings without paying extra costs, follow these step-by-step instructions to take advantage of your insurance benefits. Step 1. Understand that the Affordable Care Act requires most insurance plans to cover certain preventive services at no cost to you. These include screenings for cancer, diabetes, and heart disease. Step 2. Review your insurance plan's preventive care coverage. Call your insurance company or check their website for a complete list of covered screenings and services. Step 3. Schedule your annual wellness visit with your primary care doctor. This appointment is typically covered at no cost and includes many preventive screenings and health assessments. Step 4. Confirm with your doctor's office that services will be billed as preventive care. If screenings are coded differently, you may face unexpected charges. Step 5. Ensure you see an in-network provider for all preventive services. Out-of-network providers may not be covered at the same level or at all. Step 6. Schedule age-appropriate screenings such as mammograms, colonoscopies, and bone density tests. These are covered without cost sharing when done at recommended intervals. Step 7. Get vaccinations during preventive visits. Most insurance plans cover immunizations like flu shots, shingles vaccines, and others at no additional charge. Step 8. Keep track of when you had each screening to ensure you don't schedule them too early. Screenings done before the recommended interval may not be covered as preventive care. Don't forget to like this video and subscribe to our channel.